Okay, we are officially cooked, ladies and gentlemen. We are officially cooked. We are cooked. We are so cooked. We are cooked beyond belief. We are double cooked, triple cooked. Cooked times by 5. Cooked times by infinity. Anyways, yeah, this is gonna be long, man. I didn't stream yesterday because I had some other stuff to do, and then I ended up not revising either. So that was good. Um, Here we are. At least now we've got the flashcards on the actual website now, so you guys can actually see what I'm doing. Really, so you guys, it's always just me on my own, but helps me. Anyway, so let's go with CNS first. I think I'll do through all of these, and then I'll. What else do we have? Wait, actually, should we go CNS? CNS infection, respiratory. Oh, the number keeps on going up. All right, whatever. Infection. What is first line treatment for human and animal bites? Also, actually, I need to get something to write down things I don't know, and then that'll help me revise as well. So let me just quickly go get that wherever it is. Cool, yeah. I got some. Right, yeah, but what was it? Third. So we got 12 days left. 12? Yeah, pretty much 12 days. All right. Leave it to me to just leave everything till now. Oh man. Oh well. Anyways, human and animal bites. Flucloxacillin. I don't know. Comoxiclav. Comoxiclav. Prophylaxis. So bites equal Comox or Doxy plus Metro. So that's for bites. Interesting. So I did not know that. What treatment should be offered to patients with schizo? Schizo just some sort of antipsychotic, and it just kind of just depends on who they are, isn't it? So, there's no first line antipsychotic. Choice should be individualized. Okay, I need to know all of them though. Let me just write down antipsychotic. Antipsychotic personalization factors. I know there's a acronym COW and CROC, and these are all the ones that cause weight gain and stuff. So I think there's clozapine there, olanzapine. What's W? I don't know what W is. C chlorpromazine, risperidone. What's the other one started with O? Oh gosh. Where's the W and oh, what are they? Olanzapine. Oh no, it's the same. Oh, W is weight gain, and then Croc is also chlorpromazine, risperidone, olanzapine, quetiapine. Okay, anyways, so yeah, so metabolic risk. I'll go with that just because I don't know all of the things. How can severe acute asthma be distinguished from moderate acute asthma? How many pillows? Oh, cannot complete sentences. So 33 to 50 peak flow. Is that peak flow? Peak flow is severe, isn't it? But it's not life-threatening. Life-threatening is under 33. Our best predicted respiratory rate, at least 25 per minute, or pulse at 110 per minute. Respiratory rate of 25 per minute. Oh, okay, so they're breathing fast as well. And pulse rate of 110. Okay, so I didn't know that. So PEF 25 min and 100 and 110 per min. Okay, so I'll put that there now. How long are antibiotics used for human bite and I don't know. 3-day courses for prophylaxis. So 3 days of Comox. 3-day prof or 5-day treatment. Commonly to 7 days with review. 5 to 7. Okay. I don't know. What are common adverse effects of antipsychotics? Weight gain, QT prolongation, ED, anticholinergics, EPS symptoms. I need to put a star next to that because I need to just go over those as well. EPS symptoms, sedation, anticholinergic effects, postural hypertension, tachycardia. Postural hypertension, okay, interesting. Tachycardia, QT prolongation. Did I say that one? Should have said that one. Weight gain, dyslipidemia, oh yeah, hyperglycemia, hyperprolactinemia, ED, and NMS. NMS, I forgot that one. How is acute asthma treated initially? Asthma is now air therapy, so that is what's it called? Budesonide mixed with formoterol. 1 puff when required. 1 to 2 puffs when required. This is wrong. Acute asthma attack, I think, right? Yes, it's not wrong. I think it is meant acute asthma attack. Bro, I'm just tired. I just can't be asked. Given oxygen to maintain 94 to 98. What is the asthma range? Asthma range. SpO2. 95. That doesn't look right. Is it 95 to 100? Okay, normal range. Normal SpO2 range. Oh, it is till 95 to 100. Okay, I don't know. Consider IV magnesium sulfate. Ooh, magnesium sulfate. Oral prednisolone for 5 days until recovery. Oral prednisolone 5 days until recovery. Prednisolone 40 to 50. (94 SpO2). cute. Okay. What are first and second line options for early Lyme disease? But that's like an insect bite in it. So what did we? Oh man, I can't remember what I gave. I can just only always think of Fluclox, but it's not Fluclox. I don't know. Doxy. What's erythema migrans? Erythema. Erythema migrans. Hallmark of early Lyme disease. So animal thingy bites is Comox or Doxy plus Metro. And then Lyme disease is 100 milligram twice daily or 200 milligram once daily for 21 days. Wow. So if you're 12 plus Lyme disease. So it's Doxy 200. OD for 21 days. Amox. TDS for 21 days. So that's if they have like pregnancy or something in Doxy. So that I'll review for now. What baseline monitoring is needed before starting an antipsychotic? Baseline is just the basics. LFTs are renal function, full blood count. Oh, and the weights and stuff. Yeah. Oh yeah, in ECG as well. So weight, pulse, blood pressure, glucose, prolactin, because it can cause, yeah. If a patient cannot take oral steroids during asthma exacerbation, what can be used? IV steroids? IV hydrocortisone. What oral antibiotics are used for mild diabetic foot infection? Wait, sorry, 1 second. Let me just check if this works. If I go off this, does it save this? I don't know. No, it don't. Let me just check actually. It says 1 out of 87 do. Okay, no, it did save the actual thing, but it didn't say what page I was on. Okay, that's fine. Wait, is this on do? Oh, okay. I was like, why is it on review later? Sorry, let me just check if this works. Yes. All right, come on, load then. This is a problem. I hate how long it takes though, just for simple question. Fail to generate mock questions. We just try and figure out why that's happening. Man, I get sidetracked with doing this sort of stuff instead. Do me how they did me as a kid. Man, I need to somehow get less tired. That's the problem with me. How many flashcards have I got? Actually, 1 second. Let me just finish this first. I need to maybe do some mocks as well soon. I'm gonna do some mocks. See how it goes. Oh man. Guys, does GPT-5 Mini exist? GPT-5 Mini. Shit. Shit. What the hell going on, bro? Shit, what the hell, bro? What the hell, bro? Come on. Bro, I'm wasting so much time doing this, bro. It's not hurrying up. Done yet. Sorry, this flipping stupid site is not hurrying up. Oh my gosh. That's my jitter clicking. Look. Oh man, that didn't even sound that fast. My arm hurts though. mm, mm, mm. Come on! Come on! Oh man. This is like. Yeah, oh man. Alright, you know what? I might just carry on. This is psychotic personalization. So there's that cow, so there's clozapine, olanzapine, or chlorpromazine, risperidone, olanzapine, and quetiapine. Bites use comoxiclav or doxy plus metro for 3 days. For Lyme disease, use doxy 200 milligram for 7 days. Oh no, 21 days. But if not, then use a mox 1 gram 3 times a day for 21 days. Okay, and acute asthma, what do you do? So you give 40 to 50 milligrams of prednisolone, you give them salbutamol for 5 days at least till recovery. You try and get the SpO2 to 94 to 98. Why didn't they just say 94 plus? Because you could get more than 98. What's wrong with getting more than 98? I'm so tired, man. You know what? This is taking a bit long now, so I'm gonna carry on. Let's go. Right. As soon as I say that, then it finished. Okay, I'm gonna update it. I have no idea. Bro, how do you not get tired anymore? Why am I tired? What a BS, man. Okay. That's updating. Let's just carry on doing this for now. What is the body's natural mineralocorticoid and how does it work? Aldosterone, and it works by. Does it work on the collect? No, it works on distal tubule to reabsorb sodium and water and increase potassium and hydrogen excretion. It's producing adrenal cortex, acts mineralocorticoid on the distal nephron. You just need to just say that potassium and hydrogen ions are excreted. What is the license time window? It's 3 days, but there's also another thing as well. It's 3 days, but this doesn't have it on there, but it's not as effective or just after ovulation, I think. Or yeah, just after ovulation, then copper IUD. Otherwise, let me search that one. Is levonorgestrel effective after ovulation? Does not work after ovulation. These pills work by delaying or preventing the release of an egg. So however, this does not work after ovulation. So then what do you do? You've already ovulated. Coffee IUD is more. What about LL1? Is not effective. You already ovulated as well. However, levonorgestrel and ulipristal acetate do not work after ovulation. As they work by delaying it. Oh, I forgot about luteinizing hormone as well. We have this ability to work into the fertility windows. They show 2.5 more times effective. Hmm. Um. Luteinizing hormone. Luteinizing. Um. As they work by delaying it. Um. Up until the surge of luteinizing hormone is released. Iloprostrol acetate. Right up to the point of ovulation. Copper IUD. Copper IUD is the only effective one in this case. Okay, save card. Okay, so I know that one. Which controlled... Wait, what was this? Which controlled drugs need to be kept in... Oh, I don't know all these. Needs to be schedule 1, 2, and 3, except for there's like loads of schedule 3 ones that don't need to. Pregabalin, gabapentin, tramadol, midazolam, phenytoin, and not phenytoin, phenobarbital. That's 5, I know. There's another one. 1, 2, 3, 4, 5. Ooh. Other ones do need to. Well, actually, I guess I did know tramadol, gabapentin, pregabalin, midazolam, and phenobarbital. Except for tramadol, GABA, preg, midazolam, and pheno. So buprenorphine, diethyl propion. Buprenorphine though, that's weird, isn't it? Flunitrazepam. What's diethyl propion? Is this ADHD? Amphetamine. What even is it though? Used for... Wait, is this even UK? DI... diethyl Diethyl propion. Wait. Oh, so you can still get it unlicensed. Oh, okay. Oh, well, even though it's not on BNF, you can still get it privately, which is crazy. And then quinolbarbitone. Quinolbarbitone's not. What's quinolbarbitone? CNS. Schedule. Wow. So quinolbarbitone doesn't need to be in there. Mm, okay, well, quinolbarbitone as well. So I didn't actually know this one. So tramadol, gabapentin, pregabalin, midazolam, and phenobarbital plus quinolbarbitone. Quinolbarbitone. This schedule 2-1. I didn't know. Okay, interesting. Which NSAID has the highest gastro? It's that one starting with P. I can never remember it. Piroxicam, ketoprofen, and ketorolac. So piroxicam, ketoprofen, and ketorolac, ketorolac and ketoprofen, ketorolac. So that's like diclofenac with ketorolac. Ketorolac, ketorolac, and ketoprofen, and piroxicam. What study type is usually considered the most? So that's like just systematic reviews and systematic reviews, basically. Yeah, systematic reviews, meta-analysis. Folic acid is B9. That's because both these reduce tamoxifen exposure. CYP2D6 inhibitors. I swear, what is it? 865. I swear that should have been less, right? Or am I wrong? What antibiotics are used for mild diabetic foot infection? Foot infection. Let's go Flucox again. I don't know. Oh, yes, Flucox. Calari. Doxy. Comox is second. So Comox seems like the big, like for anything severe, like infected local ulcers or anything like that. Then it's always Comox, it seems. I think I know that. What medicines are first generation antipsychotics? Haloperidol is a dopamine antagonist. What, the one? I don't know. Haloperidol, chlorpromazine, levopromazine, chlorpromazine, levopromazine. This is actually boring. I think I need that anyway. What is this hitting here? What OTC medicine should lithium patients avoid? I know NSAIDs, they increase lithium levels, isn't it? Increase lithium levels. Hydration. I just saw this one as well. Haloperidol, no, chlorpromazine, levopromazine. I don't know the other one. Chlorpromazine, levopromazine, prochlorpromazine, and also flupentixol, zyklopentixol, sulpiride. Wait, amisulpiride's first generation. Oh, second generation. So sulpiride is first, but amisulpiride second. What adverse effects are especially EPS? They can worse Parkinson's symptoms because dopamine blockade can further reduce dopaminergic. What is hyperprolactinemia? Is it just prolactin? High levels of hormone prolactin, which, while normal during pregnancy and breastfeeding, outside leading to infertility, menstrual changes, and galactorrhea. Okay. So prolactin, the hormone, gets increased. Bro, I'm so bored at my mind, man. When will this end? I just want to go to sleep or something. Should I go to sleep? It hasn't been an hour yet. And now messed about for an hour. Okay. Sorry, I'm just updating something. Come on. Okay, published. So prolactin anemia and Parkinson's symptoms. I need to know what EPS symptoms are because I always forget. Drug-induced acute spasms, so dystonia, akathisia. Slow movements, Parkinson's. So DAPT and chronic uncontrollable facial tics, tardive dyskinesia. DAPT. DAPT. EPS are okay, and then EPS are DAPT, so dyskinesia, so muscle jerk, I think, muscle spasms. You've got aca- ac- akathisia. That's the restlessness. Dyskinesia. Let me just write that. Restlessness. You've got the Parkinson symptoms, so tremor, plus slow movement, and then you've also got the tardive dyskinesia. Facial tics. DAPT for EPS. What can be added if MRSA is suspected or confirmed in cellulitis? Then you can do IV vancomycin or teicoplanin to the regimen, or linezolid if glycopeptides cannot be used. What's that? Oxazolidinone. Bro, I'm so tired, man. Why am I always tired? I guarantee if I stop this year, then I'll be all jolly and good again, which is the annoying part. Yeah, I reloaded the page. Reload the thing, reload the thing. Okay, so that one's not done. Well, it's not done, but let's see if this works. Wait, did my flashcard save? I forgot what I was even looking for. This. Cool. I'm so tired. Should I do a mock? Just to see where I am. I think it'd be a good idea since I'm so tired already anyway. A 72-year-old man with persistent atrial fibrillation is prescribed amiodarone by his cardiologist. The medications from the repeat list are warfarin, digoxin, and statin. Asking what you will do about his medicines now that you start taking amiodarone. Amiodarone and digoxin, don't they interact? What's the single most appropriate immediate action for the pharmacist? I'm thinking this one, but I don't know. This one's a good question, bro. It generated actually a really hard question. I don't know. Oh, I got it right. But I don't know if that's even right. When starting amiodarone, digoxin dose is usually halved and warfarin dose often needs reducing with an early INR check. Also counsel patients to report muscle pain for the statin interaction and symptoms suggesting QT or bradyarrhythmia. Key learning point and initiation of amiodarone proactively adjust monitor non-therapeutic drugs and onvastatin after and QT risks. Half the digoxin check the INR. That one's actually difficult. Whew, that was a tough question. That was actually a good one though. If I can get it to generate more again. So okay, it's definitely not that one. Supply the amiodarone and then we'll ask the patient to report. Is this one here? Actually, it's not that difficult now I'm reading it, because this one's definitely true, but this one E, I wouldn't have known. But I chose A anyway. How's that ENT? That's cardio, isn't it? Oh. Is that from today saying ENT? Let me try again. That one was good, but it's also now I'm looking back at it. It wasn't as hard as I thought it was. It's just so wordy that I thought it was. The speed of this making questions is quite worrying, though, to be fair. Should I try DeepSeek? I might just try DeepSeek, you know. Fail to generate mock questions. Please try again shortly. What now? What the flip went wrong now? Let me just try DeepSeek. Oh wait, actually I don't have any money on there. Mm. Okay. Let's just carry on with these. Oh, wrong thing. How long? 5 days? Up to 5 days. Or up to 5 days after the earliest estimated date of ovulation, whichever is later. What does that mean though? What does that mean? So it means wait. Oh, AI mode. So whichever is later. So or up to 5 days after the earliest estimated date of ovulation. The rule means you can count up to 5 days. Um, lives in the body about 5 days. Implanted takes about 5 days off. And before implantation happens, within 5 days of ovulation, is to prevent pregnancy. Because you're only 2 days post ovulation, so then within the 5-day window, rule 2. So why not 10 days in total then? Based on implantation, a fertility about 5 days after the ovulation to test the moon. Yeah, interval and then ovulate. Egg reaches the womb before you ovulate. Yeah, okay, up to 5 days. Ah, okay. So 9 days is max. So it'd be 9 days maximum. So 5 days after your ovulation date. Hmm. Day 9 is the absolute last day before the egg implants into the womb. Hmm. Mm. Okay, so wait. So um, um day 1, then 5 days. Um Hmm. Hint. I'll change a hint to this. Roughly. Hmm. Hmm. I see. So there's a lifespan of 5 days. If you get the ID on the fifth day, the you can have it up until day 9, technically. Mm. So I think I know that one now. Is it Molessium contagiosum? I don't think that's how you say it anyway. Molessium contagiosum. Why didn't that work? Well, that needs fixing. Oh, I skipped it. Oops. What are the 2 important serious side effects? I don't know. What are they? Venous thromboembolism. I mean, that's with breast cancer meds in general. Endometrial changes. So bleeding, bleeding. Hot flushes, mood. What drugs have significant mineralocorticoid activity? Mineralocorticoid antagonist. So spironolactone and eplerenone. And the other one would be fludrocortisone, which is a mineralocorticoid, and hydrocortisone has split activity between glucocorticoids and mineralocorticoids. Okay. What? I clicked skip and it's come back already. Why isn't the scrolling work on this one? Molluscum contagiosum. Viral skin infection. Oh, I didn't know that. I need to know actually how to treat these though. Or self-limiting. Okay. I'll put that there for now. What is required for a female patient under 55? So he has never had a 2 specialist. The 2 specialists. Oh, there's quite a few things. 2 specialists. Needs to be an annual form filled out. They need to sign the form as well. Annual form. Pregnancy prevention program. That 4 things? Second opinion. So that's a 2 specialist review. Pregnancy prevention and annual. So 3 things. And then later ones only require 1. I'll put that in there for now. What is the license time window for all? So that's 5 days. Why does the hint just tell you? 128 hours or 5 days. Take as soon as possible. Progestins can reduce all progestal effectiveness. Use until contraception liable again. I didn't know about the hormonal thing though. What should be recorded when making an emergency supply at the request of a patient? I don't know what in the POM register. What should be recorded? The date, patient detail. Oh, of course that stuff. Reason for emergency supply and why prescription could not be dispensed. Date. Human medicine regulation. Hyperparathyroidism. Vitamin D. Cholecalciferol. Hyperparathyroidism. NSAIDs have lower GI risk. Ibuprofen. What patients group should be considered for offering statin treatments? Also, there's three things. I think diabetes. Oh no, there's quite a few in it. Well, obviously the considered. They should definitely be on some. Oh man, I'm too tired though, man. Should I just do a mock for now? What time is it? Oh, 1:50. Wait a second. I just saw the time. 1:30. Oh gosh. Huh? What do I mean? Do I get cut off my thing? No, it doesn't. Does it? Oh, it does. There we go. 20 milligram for Q risk 10% or more. Yeah, we already knew that. They are high risk of having a cardiovascular event within the next 10 years. 10% chance. So 1 in 10 people with a Q risk of this 10% or higher will have a cardiovascular event of some sort. But so if it's below, but the risk is underestimated, and the patient has informed preference, secondary prevention, diabetes, type 1 diabetes, over 40. So if they have type 1 diabetes and they're over 40, diabetes for 10 more years, nephropathy, or other CVD factors. So basically, nephropathy, I need to remember nephropathy 10 years or more, and 40 or over, diabetes type 1. What vitamin supplement should vitamin A? Cod liver oil. Ooh, I forgot about that one. Because excess retinol can harm the baby. Does fish liver oil contain that? Does cod liver oil contain retinol? Yes. Oh, it has lots of vitamin A. Wait, what? Alongside vitamin D? So liver oil contains vitamin D, vitamin A, and omega-3 fatty acids. So, but the vitamin A is bad though. And the retinol inside of it is also cod liver oil, fish liver oil supplements. Why does lactose interact with E-cimesalicine? Lactulose. Enteric coated lactulose. Lactulose, does it lower the pH or something like that? No, acidifies colonic contents. So lactulose, what does it do? How does lactulose acidify the colon? Acidifies the colon through bacterial fermentation. Wait, why am I doing GI ones? So I didn't know that one. This is mainly a caution rather than universal contraindication. A person who recognizes their drug use is worsening and asks where to get help is at which stage of the cycle of change. I don't know that. Should I go on it? This is a change of smoking. Contemplation. Cycle of change. Just search it up. Oh my gosh, there's so many. Relapse, pre-contemplation, contemplation, preparation, action, maintenance. Hint. Relapse, pre-contemplation, contemplation, preparation, action, and maintenance. Save. So contemplation. No one's. I mean, I'll just put it there for now, but yeah. After missing a combined hormone contraceptive pill, how long are extra precautions needed? 7 days? Wait, what does this mean? If missed pills rules require 7 consecutive action when have been taken. So that's 7 days, isn't it? Assess whether emergency contraception is needed, especially if pills were missed in week 1 or the hormone-free interval was extended. So basically 1 week. How can this be possible? Well, STI-related discharge. So that one's okay. Yeah, odor and discharge. Yeah, basically. Yeah, odor, white discharge. That's odorless. That's thin, and then colored. Then never know. How do NSAIDs work? Non-steroidal, so they inhibit COX enzymes. Reducing prostaglandins. COX 1 and 2. Prostaglandin production. Antipyretic. How does megaloblastic anemia, low HB, I think, raised MCV, HB and red cell count may be low. It can be caused by vitamin B12 or folate deficiency. I don't know. That's high, not urticaria. Let's do it in the hives and urticaria again. Hives versus urticaria. Oh, they're the same thing. Urticaria also known as hives. Itchy raised wheals. Lesions may appear suddenly and often move. Can be triggered by allergy, infection, medicines. Use heat, cold, or pressure. Check for features of anaphylaxis such as swelling or lesions. I think I need that one. Corticoid side effects. So that's sodium, high blood pressure. Yeah, edema and high blood pressure, potassium loss. Oh yeah. Because excretion of potassium and hydrogen ions. Calcium loss with long-term exposure. Calcium loss. What is required for a female under 55 taking after 2? Especially so agreed treatment, then just after that is just one annual review pregnancy prevention program and yeah, I don't know. Prevention program, annual risk form, and special signature on the annual review. I think I knew that one. What laxative can be used? Lactulose, it reduces the ammonia in hepatic encephalopathy. Ammonia absorption by acidifying the colon. Also, that's the same mechanism. And trapping ammonia as ammonium. Absorption. It reduces the absorption of ammonia. What common medicines are Schedule 3 controlled drugs? Put that my mind, man. I just want to go to sleep. Okay. Talk about those 5, isn't it? Midazolam. Pregabalin, gabapentin. That's 3. Tramadol. 4. Phenobarbital, 5. So those are the ones you keep out the cupboard. What's the other ones you keep in the cupboard? I can't remember. Buprenorphine, temazepam, buprenorphine and buprenorphine and temazepam. Buprenorphine and temazepam. Put that in there because I don't know the ones in there. Buprenorphine and temazepam. Oh man. Buprenorphine, temazepam. Temazepam. What medicine interactions are especially important with methotrexate? Methotrexate. Trimethoprim. What's the other one? Is this another one like trimethoprim? Is this sulfamethoxazole or something like that? Cotrimoxazole. Cotrimoxazole with trimethoprim is cotrimoxazole. Man, I messed up. I had to search it up. Sulfamethoxazole mixed with coach. NSAIDs. Penicillins. PPIs. I did not know half of those. So. Which statin doses are classed as? So atorvastatin is 20. Shall I reveal? Let me just remove this hint. So yeah, atorvastatin 20. Atorvastatin 20 to 80, and then you got rosuvastatin maybe 10 to 40. Then you got simvastatin is 20 to 40. 20 sounds like medium. I think 40 is high. And then what else is there? I can't remember the other one. Oh, 80 is high. So simvastatin 40 is only medium. It's medium intensity 40, so yeah. Okay. How long should a signed order requisition for wholesale supplies of CDs be kept? 5 years? 2 years. Requisitions and signed orders for wholesale supplies of CDs should be kept for 2 years. B12 deficiency. Mouth ulcers. Breathlessness. Numbness. So like anemia type things. Why does sometimes the scroll doesn't work? That's weird. That's psoriasis. Psoriasis. Put there for now. What are the indications for mineral corticosteroids? Indications? Actually, don't know. Adrenal insufficiency. For severe postural hypertension under specialist advice. Okay. Wait a second. What time is it? Oh crap! I need to read this. Ah man. Okay, I think I'm gonna be back, and then I'm gonna do maybe a mock. Need to do my first mock and see where I'm at. Maybe the RPS mock I'll do. Maybe a good one to do. Yeah, I'll probably just do a mock. I can't be bothered though. It's gonna take so long. I did not know this anyway. You can double this one, isn't it? Progesterone only. Wait, which one? Oh crap! Why do I forget that anyway? Levonorgestrel and olpristal, both progesterone based. I'm pretty sure. Progestin. Oh yeah, sorry. Levonorgestrel is progestin, while olpristal is progesterone receptor modulator. Oh, desogestrel. I need to. Okay, I'm gonna go through that again. I won't even put it on review because that's okay. Yeah, I'll be back. I'm just gonna take a short break and then I'll be back. Or I'll see you in a bit. Rightio. Yeah, skip that for now. Wait, didn't I already do this one? Under 55, so two specialists. They have to sign. It needs to be needs an annual form. It also needs pregnancy prevention program. So two specialists, they need to sign a document of initiation, pregnancy prevention program, and then annual review. Okay. Bulk forming laxatives can cause. Is this the toxic megacolon or is that something else? No, what's toxic megacolon created by? Toxic megacolon. Medication cause. Medicines used to stop diarrhea like loperamide. Opioids. Anticholinergics. Okay. So obstruction or fecal impaction. Because I think once you have water, add the water to them, then they swell up. What monitoring pattern is commonly used for conventional DMARDs after starting or changing dose? LFTs? Non-LFTs. It's always done. Full blood counts. I'm not sure else. Or full blood counts, LFTs, and renal function every 2 weeks until the dose has been stable. Then monthly for 3 months. What statin doses are usually used for primary and secondary CVD prevention? 20 and 80 milligram of atorvastatin. Why does it keep on trying to give me that one? Which analgesics are commonly used for dental pain? Bonjala. I have no idea. Ibuprofen and paracetamol. Diclofenac can be effective for moderate inflammatory. Has higher cardiovascular GI caution than not simply. So ibuprofen and paracetamol, really? Oh, okay. What medicines can cause or worsen dyspepsia or reflux syndrome? NSAIDs? NSAIDs, corticosteroids, bisphosphonates, nitrates, theophylline. How do theophylline and nitrates make it worse in CCBs? How do CCB, nitrates, and theophylline make dyspepsia worse? They relax the lower esophageal sphincter. Okay. They basically just weaken the sphincter. These all okay. I would not know this. How about NSAIDs then? How do NSAIDs? Is it just because of the? Is it just because of the GI? How about biphosphonates? I think that's just a esophageal lining, isn't it? Yeah. really wants me to do that one. Which oral may require double dose levonorgestrel? Which should not be doubled? Is it only levonorgestrel? So what is desogestrel then? Is it just a normal one, progesterone pill? It's not an emergency one. It's just a hormone used for daily contraception to prevent pregnancy before it happens. So preventative. If you take 11 out, then you need to the very next day. How you? Okay. Wow, this is hard to remember. Okay. Okay. I need to write about the L1 and desogestrel. So 11L is the only one you double. Certain medications cause the liver to break down before it can do its job. If any of the following have been taken in the past 4 weeks, a double dose may. Past 4 weeks? L1 cannot be used with these medicines. L1 cannot be used with a bunch of. So it induces a bunch of these. If your weight is high, taking interacting a couple IUD. Okay. Okay. So this is kind of hard for me to remember, just because. So L1 you can't use it with, but desogestrel L1. For 5 days you stop taking it. Mm. So 5 days stop. 12 hour plus 12-hour missed. Then you do 5 days stop, take an LO1, and then 7 days barrier for 7 days. Oh my god, bro. Oh my god, bro. Oh my god. What is this? The scabies. I don't know how to treat it though. What are the missed pill rules? I'm gonna shuffle. Type 1 diabetes treatment overview. The overview. Insulin first line, and then metformin if need be. Lifelong insulin with BMI 25 or above or 23 or above. I would not remember that. Hey, which one do type 1 even use? Which insulin do type 1 use? A fast acting insulin. So is that short or is that rapid? First line, nice. Recommend multiple daily basal bolus. So Detamere. So they just recommend basal bolus. Okay, I will put that there for because I didn't know about the 25 and thingy. What are the dispensing requirements for valproate containing medicines? So it needs to be a full pack. And needs pregnancy prevention program on it. Round up so do not repackage into plain stuff. So they need all of the thing though. When is it not Thibodeau? I don't like this sort of stuff, so I don't like doing these ones. What are some cautions of SGLT to use? They do stuff. do. They what's it called? Okay, especially canagliflozin, it does the lower limb amputation, and other ones, what's it called? Oh, Fournier's gangrene, UTIs, um, higher blood pressure, not really that much, but still. No, wait, not higher blood pressure, lower blood pressure. Sorry. Yeah. Low. Oh, this is asking a completely other thing. Okay. Renal thresholds. I don't know the renal thresholds. Renal BNF thresholds for SGLT2s. CKD can be. Man, why is it so annoyingly written? 20 to 45 and a 45 to 90. Okay. MPAG, avoid initiation if less than 20. Not recommended if less than 20. Stop treatment if it's persistent below 30. If EGFR is 30 to 60, the dose is limited to 10 daily. Stupid. I ain't gonna let you get a chance. Stupid. Right. This is very annoyingly written. The glucose lung is reduced to when EG4 is less than 45. Why is it really like that there? In patients tolerating 100 milligram and requiring additional, the dose can be 300 milligram. Okay. Between 30 and 60, maintained at 100, should not be initiated. Right, there's a lot of waffle here. Okay, you know, I'm just gonna save it like this and just put it on review for now because there is a lot of waffle. What are some red flags of dyspepsia? Just bleeding in it. Bleeding in it. Bleeding, cover of blood. Dysphagia. Wait, what's dysphagia and just difficulty swallowing? Dysphagia. Difficulty swallowing. What's odinophia though? Odinophagia. Odinophagia. Painful swallowing. Odinophagia. Odinophagia. Okay. Interesting. Persistent vomiting. Unexplained weight loss. Iron deficiency anemia. New dyspepsia in an adult. especially age 55 or over, or symptoms suggesting upper GI cancer. In the bin because I don't remember that. It really wants me to do this one. I am getting fed up. I'm just going to spam this a billion times. I've got 800 and it keeps giving me that same one. Deary, deary me. How should a patient use a PMDI? Hold for 10 seconds. So DPI is fast. This one is press hard on the button, shake. Hold the breath for 10 seconds. I'd try and inhale deeply. I don't know how fast though. Breathe out gently, seal lips. Press the canister slowly and steadily. Slowly and steadily continue to breathe in. Okay, well, I didn't know that, so remove cap. People always forget to remove the cap. Shake the inhaler, breathe out gently, seal lips around the mouthpiece, press the canister once while breathing out in and out, in slowly and steadily. You need to breathe in, hold breath for 10 seconds. As long as it's comfortable, then breathe out gently. What is a Pixaman dose for stroke prevention in AF and when is it reduced? So, stroke prevention in AF. Why is it telling me the answer? This should be removed. Okay, what is the dose? So 5 milligram BD, which it already told me, but I already knew. 2.5 milligram is reduced when 133 serum creatinine plus weight below 60 plus age over 80. It needs to meet 2 of those criteria. Age 80 over, body weight 60 kilogram or less, and 133 micromole but less of serum creatinine. Okay. Are you kidding me? When should naloxone be used for opioid-induced constipation? Use a stimulant and osmotics first. At least moderate opioid-induced constipation despite taking at least one laxative class for at least 4 days in the previous 4. Okay, never mind. Not adequately response. So, as at least moderate. Despite taking at least one laxative class at least 4 days in the previous 2 weeks. One laxative class, 4 days in the previous 2 weeks. I don't even know what naloxone is. What is it? What type of laxative is it? It is the mu receptor ones. Yep, and then loperamide is also actually a one, isn't it? Very interesting. Oh, and then that's the way you can like literally take so much loperamide and then get high off them, which is interesting. But actually, I didn't know this. So you need to do for at least one class for at least 4 days in the past 2 weeks. Side effects: darker urine. What are the side effects? I don't know. Metallic taste is a big one. There's no dark urine. Furred tongue, nausea, vomiting, metallic taste. What does that mean? Ugh. Guys, whatever you do, do not search third tongue. What the flip is that? Ugh. Harmless, painless, and temporary. That is disgusting. Metronidazole third tongue. Weird, weird, weird. So metronidazole doesn't cause dark urine. Discoloration is rare. Wait, metronidazole, BNF. I want to just see what they've for side effects. Dry mouth, myalgia, nausea, uncommon, rare. It's not even rare. Oh wait, no, it is. Well, I guess I didn't know about that one. But third tongue is an interesting one. What are the Bro, this is so annoying that keeps giving that question. Is lithium safe in pregnancy? Breastfeeding people who become pregnant? But then, isn't there a risk to the mother if you don't give lithium? I don't think it's safe, but I don't know. Maybe you after counseling, yeah, risk or benefit. First trimester and delivery. Lithium passing into milk and infant toxicity possible. I did not know. Oh, croup dexamethasone 500 is it micrograms or milligrams? 500 micrograms. Oh, single dose. Yeah, I need single dose, but no, 150 more. What? Dexamethasone. Mild croup is 150 per kilogram. Severe is wait, these are child doses. Where's the is croup only children or something? Do children only? Oh, mainly affects children. But what is it again? That causes swelling of the voice box. Seal like barking cough. Croup is a do 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 do. Croup is a common childhood viral infection that causes swelling of the voice, swelling of the larynx, and windpipe. Good hint, chat. Good hint. Narrowing the airway resulting in a distinctive seal-like barking cough. What does it sound like? So, childhood 6 months to 3 years. Save. Let's see what it looks like now. Hint. Croup is a common childhood 6 months to 3 years viral infection that causes swelling of the larynx and windpipe and narrow, thereby resulting in a distinctive seal-like barking cough. Croup sound. Why does that? That sounds fake. That doesn't sound like a real noise. Anyways. So 150 micrograms per. Oh, there's 500. Where did I get that from? 150 micrograms per kilogram for one dose, and that's it. And then severe is uh, severe is 150, then transferred to the hospital, then another 150 per gram, then another to be given 12 hours after the previous dose. What? That is literally no sense. Didn't even tell you like the time in between, but okay. Okay. Okay, so that's interesting. Alright. I swear, man. Which medicines can be supplied as an emergency supply at a patient's request? All POM, and then CDs for 5 days max. Right? Oh, never mind. Any POM, schedule 4 and 5 CDs, phenobarbital for epilepsy for 5 days, I'm pretty sure. Sorry. Phenobarbital. Maximum of 5 days supply. Okay. Save. Alright, so any POM, schedule 4 and 5s, phenobarbital. Review. Adrenal crisis. Adrenal insufficiency. That's what mineral corticoids are for. So, fludrocortisone and hydrocortisone IM. Oh, never mind. It's just IM IV. Do not wait for confirmatory blood tests. Goodbye. Oh man, that's too difficult. Just go in there, man. I don't know. Vomiting or diarrhea within what time after? Why is it more of this nonsense? Is it within 3 hours? 2 hours. No wait. 3 hours for those for combined. What's the combined ones again? Microgynon, I think, right? What are combined? So I hate when it doesn't give you a micro going on. Okay, anyway, so micro going on 2 hours, 3 hours for progesterone only pills. 4 hours for 12-hour ones. So check the protected device. Severe diarrhea can also reduce absorption. Use extra precautions according to pill type and duration of illness. Okay, I did not know. Bro, I feel like I've got too many review 50. How many have I done? 78 or something. So like 30 of those are like, oh my gosh. What are the requirements for male patient under 55? Same requirements as the female in it, except pregnancy prevention. Oh, I can't remember that. Valproate must not be started unless to consider that there's no effective or tolerated treatment. So, wow, that's okay. They don't need the annual risk one. We should receive counseling. So they don't need the annual risk form. Wow. What can be added if MRSA is suspected or confirmed cellulitis? Comoxiclav. Oh, that's the vancomycin one. Are you kidding me, bro? Oh, Linezolid as well. I was thinking of Linezolid. Are you kidding me, bro? What is the first line treatment for newly diagnosed asthma? That's what I was talking about earlier. Budesonide and formoterol. Air therapy. And then it goes to MART therapy. Okay. Glucocorticoid is cortisol, and how does it work? How does it work? Cortisol released from adrenal cortex and acts on. Oh, what was HPA again? How does it got to do with? HPA, cortisol, hypothalamic pituitary adrenal. Axis pathway. Is it axis or pathway? Axis. I don't even know why it's called axis though. Hypothalamus releases CRH, ACTH, cortisol. Adrenocortical, ACTH, pituitary gland. Which pituitary gland is it? The posterior or the anterior? Anterior pituitary gland. Adrenocorticotropic anterior. He actually knows the adrenocortical synthesize and release cortisol. And you might make cortisol spike right now. I'm cortisol spiking, mate. Cortisol spiking. Bro, this is not even a source, man. Are you kidding me, bro? Nope. Oh, I liked how you just went over that way. What is the mechanism of actions of a statin? HMG coenzyme reductase inhibitor, which stops the synthesization of cholesterol in the liver. I think. What the hell? It literally tells you the answer there. HMG coenzyme. HMG reductase, the rate limiting enzyme in hepatic cholesterol synthesis. Remove that hint. Save. You stupid idiot. You stupid idiot. Stupid, I ain't gonna let you get the chance. What red flags? Methotrexate toxicity. Toxicity. I'll be like, your liver starts hurting in it. I don't know actually. What's that flipping blood disorder called? Forget it, man. Oh, wait, what? That's toxicity, you get sore throat. I thought that's just general, you can just get that. Oh. Shortness of breath. Persistent dry cough. Pneumonitis. Severe nausea, vomiting, diarrhea, or signs of dehydration. Abnormal blood. Oh, that's what I was talking about. Cytopenias, creatinine, EGFR, and if it falls, or significant liver enzyme rise. So, sore throat, fever, mouth ulcers, unexplained bruising, bleeding, shortness of breath, persistent dry cough. May suggest pneumonitis, nausea, vomiting, and diarrhea or signs of dehydration. Alright, I don't even remember any of what I just read because I was too busy doing this bloody accent. Sore throat, fever, mouth ulcers. Okay, so yeah, so that sort of stuff. Then shortness of breath, pneumonitis, and nausea, vomiting, dehydration, cytopenias, thrombocytopenia, any cytopenias, rising creatinine, fall of significant enzyme rise. Okay, I don't know any of that, so that's going there. What should you always give folic acid with, or at least test for? Methotrexate. Pregnancy, 400 micrograms up until 12 weeks. Oh. Megaloblastic anemia. And improve the anemia while allowing B12 regulated neurological damage. Did not know that, mate. When can you use higher doses of loperamide? When the consultant says, no, what's it called? Loperamide. I've seen incontinence. There's another one though. What's the other one? For high output stoma. Yes. Short bowel syndrome or high output fistula. With monitoring for dehydration and cardiac risk. When should a patient requesting amultrine nail lacquer for suspected fungal nail infection be referred? Refer or seek pharmacist. I'm the flipping pharmacist. Why are you telling me? Let me just remove that. There we are. Refer or seek medical assessment if patient is under 18, more than 2 year nails affected, nail matrix, patient is pregnant or breastfeeding, diabetes, blah blah. Bro, I don't know any of that. When should NSAIDs? I don't know. Week 20. I don't know. I can't keep on putting them all in there though. Which antiemetics are commonly used first line for nausea, vomiting in pregnancy? Antiemetics. Wait, what? Let's list you all of them. Cyclizine, promethazine, cyclizine, promethazine, prochlorperazine. I wake up in the morning like I'm wrong. I thought. Bro, that's why I keep on getting confused, man. Promethazine is both antiemetic and antihistamine. Dirty, dirty drug. Dirty drug. Cyclizine is also both. And then prochlorperazine. Are these second generation or something? Prochlorperazine is not one. An antihistamine. Chlorpromazine. Chlorpromazine was initially developed in the 1950s as an antihistamine, but it is now an antipsychotic drug. Wait, actually, yeah, these are antipsychotics. Prochlorperazine and chlorpromazine. Promethazine antipsychotic. I am getting so confused. Is pyridoxine B6, I thought? Pyridoxine B6. It is? What? What's doxylamine? First generation over-the-counter antihistamine used in combination with B6, nausea and vomiting pregnancy. It induces strong sedation and typically takes effect within 30 minutes. Very good. Very, very good. Sad. That one I need to review again, mate. Which CDs need to be recorded in the controlled drug register? So, schedules 2, 3. Ooh, one of the schedule 2s don't need to be. What was it called? And here's where I fail. Ooh, it was starting with. Was it Q? Ooh. That's very annoying because I don't know all the rest. So tramadol, pregabalin, gabapentin, phenobarbital, midazolam. But what's this one? Quenzilamine. Yeah, that's what it's called. Ooh, is it? Well, it sounds like a benzodiazepine. Zepam. Quenzepam. I don't know. What? Oh, oh shoot! I wasn't even reading it properly. I'm a flippin' idiot. Didn't even read it right. Okay, I just got this one again. When? When you want, mate? That's when. No, when they're under 18, and more than one nail is affected. Yeah, I don't know. Under 18, more than one nail. Lunula pulsar, nail matrix. Pregnant breastfeeding, diabetes, poor circulation. Immunosuppressed or nail pain. Signs of bacterial infection rather than fungal nail infection. Is amarilophine nail lacquer safe for pregnancy? Should be generally avoided. Used to treat mild to moderate fungal nail infections. Interesting. So say someone comes in, they're under 18, they got multiple, it looks like a bacterial infection, they're diabetic, they're immunosuppressed, it looks like the lanula, which I'm assuming is that white of your nail, and the nail matrix. Lanula. Yeah, and then where's the nail matrix? Nail matrix. Right, why am I seeing pictures of the nail matrix being damaged? That's disgusting. Yikes. Yeah, that's a review. When should NSAIDs be avoided in pregnancy? When? Ooh. I just did this one. Is it week 20? Week 20 and also in the third trimester after week 28 is very bad. Well, from week 20, because of oligohydramnios. What even is that? Let me just search. Will help me remember it more. Oligohydramnios. Where the amniotic fluid is significantly lower than expected for the gestational age. So basically, there's not enough fluid. Okay. Let me just add that one in. Okay. Ductus arteriosus. A crucial fetal blood vessel that connects the pulmonary artery to the aorta. Fetal, it's only fetal. Very, very interesting, mate. That's very interesting. How is folic acid usually taken with low dose weekly methotrexate? So I just know it's taken in it. It's taken. It's taken. I don't know how many days after though. But yeah, just another day. Not on the same day. Best day. Mm, 48 prior. 48 hours prior. 48 days prior. Just remove this nonsense. Coolio. That's some scarlet fever, that is. Although I always get confused with the chaps cheek syndrome, slap cheek syndrome. Put that there because atypical antipsychotics. Olanzapine, risperidone, quetiapine, chlorpromazine. It's clozapine one. Yeah, clozapine, I don't know. Yeah, that should be all of them. Right. Did I say all of them? Quetiapine, olanzapine, risperidone. Chlorpromazine is not here. Uh-oh. Uh-oh. Is chlorpromazine first or second generation? Oh, is first. Uh-oh. This is aripiprazole, amisulpride, clozapine, olanzapine, quetiapine, and risperidone. GI bleed, woo! And nephrotoxic, and some hot ones. Yep. Dyspepsia. Dyspepsia, yeah, I forgot about that one. Dyspepsia, renal impairment, AKI. What's the heart failure? Blood pressure increases, asthma, hyperkalemia. I forgot so many there. What are the main adverse effects and safety risks of valproate? Look at how many I've put in review, man. That's bad. valproate, hepatitis, blood dyscrasius, pancreatitis, and one more. Uh, which ones do SJS? Which one does valproate do SJS? Steven Johnson syndrome. I don't know. I have no idea, sir. Yeah, I don't know what the last one is. Hepatotoxicity or teratogenicity. Man. F them. Man. F them, man. What drugs have significant activity and what are the potencies equivalent to penicillin? 5 milligram of prednisolone is about equivalent to 4 milligram of methylprednisolone. Hydrocortisone is equivalent, 20 milligram is equivalent to 5. And I don't know the rest. Okay, betamethasone, dexamethasone, 750 micrograms. Micrograms. Wow. And what does that reference have got to do with anything? I don't know why it keeps on putting that one there. 20. So 750 micrograms, bro. Madness. Know that when you add this. That is a reveal. So that's just flu clocks. Oh, I should always think about penicillin. Claridoxy erythro. Minimum age 2. Bro, why did it tell you here? And you're not supposed to have in pregnancy because of gray baby syndrome. I need to talk about the pregnancy as well. Eye or eardrops is safe. Wait. That's what chloramphenicol comes as? Is there any... Chloramphenicol can be used in pregnancy eye drops. But then, is there tablets or something? Or eye drop, medicinal forms, oral capsules? When is that even ever used? 250, 300, of nearly £400. So when is that ever used? Hmm. So you can use chloramphenicol eye drops in the third trimester. Third trimester. Eye and ear drops. Avoid using them in the essentially systemic use. So BNF. What does that say? Pregnancy. Manufacturer advises void. Intravenous or oral use. Okay, well, I guess I'll just keep that in mind then. Now, I've always just thought, oh, great baby syndrome. There's always just a waffle on about that, isn't it? Okay, well, well, I knew that one actually. Well, did I? Third trimester. Oh, I guess I didn't know about the flipping. Yeah, whatever. What is a step-up pathway if, as needed, air therapy does not control asthma? It's what's it called? MART therapy, maintenance and reliever. Then you use one puff twice a day, or you'd use 2 puffs twice a day. Yep. No dose MART. Moderate dose MART. Check FeNO and blood is intervals. FeNO. If neither is raised, try what's it called? Leukotriene receptor antagonist or LAMA. Wait 12 weeks. I have no idea. B6 is pyridoxine. When should combined hormonal contraception be stopped and restarted around? Ooh. 4 weeks before? Oh. And then restart only after full mobilization, coming in 2 weeks after full removal. I forgot I restarted. I forgot to say restarted. When should statin treatment be stopped or held? CK 5 times more. Creatine kinase, transaminase 3 times the upper limit of normal. Interstitial lung disease, unexplained cough, dyspnea, and weight loss. Liver transaminases, upper limit of normal. Upper limit of normal. Upper limits of normal. So creatine kinase, sorry. Creatine kinase 3 times upper limit. Of creatine kinase 5 times upper limit, and then liver transaminase is 3 times upper limit. And then if they have liver interstitial disease or explained cough, dyspnea, weight loss, or inhibitor. With meals and snacks. If several are needed, do not take it without food. With meals and snacks. I think I know. Which controlled drugs need formal destruction arrangements? 2, 3, and 4, part 1. Part 1 as well. Oi, oi, oi. Oh man. Which medicines can be used for pain during breastfeeding? Paracetamol, and then I don't know. Ibuprofen, NSAID. Okay. Diclofenac, ibuprofen. Use the lowest effective dose for the shortest time. Can statins be used in pregnancy? Hint. I think I would have said no anyway. But I didn't know 3 months before trying to see if I would have known that, so I need to throw it away anyway. No, they don't. They don't even need the annual form. What adverse effect are especially associated EPS? Ooh, EPS, which I made a thingy for. DAPT. Dyskinesia, which is involuntary muscle movements, I think. Akathisia, which is restlessness, which I have right now for some reason. Parkinson's symptoms, so like tremors and slow movements. And then lastly, what's T? Oh, tardive dyskinesia, which is like like uncontrolled facial movements, like rolling of the tongue and stuff. Oh, completely wrong. Metabolic. It's the weight gain, dyslipidemia, and glucose intolerance. Diabetes risk is highest with clozapine and olanzapine, but all antipsychotics need metabolic monitoring. Okay. Clozapine and olanzapine are the highest. Yeah, I thought so. Olanzapine sounds like a fat drug, man. Or antipsychotic antibiotic is first line for cellulitis near the iron nose? Still gotta be Fluclox, right? Or no? Comox. Because of the anatomical risk. Did not know that. What color can amitriptyline turn urine? It just darkens it, doesn't it? Blue, green. Wow. Why is my pee green? That sounds kind of cool. What is first line treatment for newly diagnosed asthma in people aged 12 and over who are highly symptomatic or presenting with a severe exacerbation? So severe. You said, I think I read the check the FeNO, check the eosinophils, check, and then put them on Montelukast. Was it leukotriene receptor antagonist? No, I can't remember what it's called. But then the other one was also LABA. Oh, so you'd still start low dose, yeah. Then that meant. Okay, whatever. Desogestrel, literally 12 hours in it. If pill is more than 12 hours late, take pill as soon as remembered. Continue the next pill at the usual time. I did not know you still had to do this though. Ooh, this one I don't know. Starts with R. Riboflavin. Ah, IBS. These ones are difficult though. I can't remember them. I remember the like weird ones. Oh wait, what? Amitriptyline. Loperamide and antispasmodics don't work then. Amitriptyline or SSRIs. Okay, how many have I done? Am I done yet? Well, technically, I've got like 82. Bro, that's like majority of them. What even is that? 5 plus 25? That's 30. 80 split. 100. Unbelievable. Okay, chat. Should I just see if I can find that? GPHC mock exam. Where is a mock exam, bruh? GPHC mock exam. Why is that AI just finding it for me if it's so useful? Go on, find it. RPS has one. Find me the GPHC Mach 3. Assessment Hub. Bro, where is it? Is this it? Common registration assessment example questions. That's gotta be it. Wait, is that off the website? CRA example questions guide. Oh, this has gotta be it. Figure 1, part 1. Wait, what? This. Answers to the SBA sample questions. Where are the sample questions? Wait, what? Why is it giving me the answers? Yeah, and it's not even telling me the answers to part 1 example questions. What the Sigma? What the Sigma? Okay. Okay. I literally can't find it, man. Chat, I can't find it. Did find them. Surpass all of software. Open it. Scroll down to the middle of the page in the example questions section. How the hell am I missing the example questions section? Questions. Example. Is it deleted or something? Exiting the common registration assessment hub. Ah, found it finally. What? Ah, it's just like waffling in it. I just kind of can't be asked to do it now though. I finally found it and I can't be asked. Let me go back. Just leave the site. Okay, wait, I need to save this. Finally found it, bro. I never knew this existed, bro. Never ever knew. Never ever knew, never ever. Save. Done. Donzo bazonzo. Alright, anyway, so that's about 100 done, and then like about 80 I've just made to do again anyway, so that's a bit useless in it. But I'll come back later then, yeah, tomorrow. By that, I mean tomorrow. Anyways, see ya. Bye.